Now to a health alert that may not sit well with women across Metro Detroit and the U.S. A new study reveals that American women have a shorter life expectancy and face a higher rate of avoidable deaths among 14 other high-income countries. Our chief health editor, Dr. Partha Nandi, joining us now to discuss these surprising findings, Doc. And what is it about us American women, and what are the diseases that are most likely to cause this?
This is super disappointing to me, too. The study comes from the Commonwealth Fund. Researchers found that women in the U.S. live about 80 years, which is the shortest amongst the 14 high-income countries studied, so it's very disappointing. On average, American women live 2 years less than peers in the United Kingdom, 4 less than those in Canada, 6 years less than those in France, and 7 years less than those in Japan. This is despite the fact that the U.S. spends more money on healthcare than these countries. When it comes to the cause of death, heart disease, leading issue for women in the U.S. among the 14 countries. The U.S. has the highest number of women dying from heart disease. Sadly, the rate was more than double what was seen in some countries. Also, when looking at health status, women in the U.S. face more chronic health conditions compared to their peers in most of the other countries. They also tend to take a lot more prescription medications, which is about a quarter of them using at least 4 different drugs. That's like 4 different drugs regularly. For black women in the U.S., nearly 40% are on 4 or more prescription meds. Furthermore, American women are more likely to skip mental health services and have some of the highest rates of mental and social needs. For avoidable deaths, U.S. women top the list with rates more than 3 times higher than peers in Korea and Japan. So not a lot of great news there.
Prescription drugs on that list.
100%.
Oh boy, so challenges that we face and why? Yeah.
That's the important question, right? So the U.S. is the only wealthy country, as you know, Glenda, without universal health care. That's a big deal. So it's no surprise that women here face significant challenges. In 2023, 14% of women, 14, aged 19 to 64 were uninsured, with over a quarter of Hispanic women affected. Half of women in the U.S. reported skipping or delaying necessary medical care because of cost, and they're less likely to have a regular doctor. Also, Hispanic and black women are the most likely to report having at least one social need, like worries about food, housing, or steady income. To help make things better, it's important to advocate for better health care policies, in my opinion, and support programs that address both health and social needs. Remember, having a regular doctor can help big time. You can stay on top of your health and catch issues early. And I'll tell you, when people come and tell me, listen, I don't want to have this because it's too expensive, talk to your doctor and say, is there a payment plan? Just don't put it off because you think it's too expensive. It's a big deal. And I think we should talk to our representatives and say, can we get more coverage universally? I know people don't always love that, but all of us eventually pay for it. And then women and men pay for it with their lives.
That's a scary statistic, Doc.
100%, but it's real, and people need to address it instead of just throwing it, and not even thinking about it.
Thank you for talking with us today.
Hey, my pleasure.
All right, see you soon.
Of course.
This week on the Dr. Nandi Show, Dr. Nandi tackles the incredibly tough topic of suicide with survivor families touched by the loss of a loved one, the signs to be on the lookout for, and how Hollywood is changing the face of mental health awareness. Tune in this Saturday at 12:30 p.m.